could you share your name and your title?
I will. I'm Pastor Andrea DeGroot-Nesdahl. I serve now out of the office of the presiding bishop of the ELCA. My title is coordinator of the Lutheran Malaria Initiative and the HIV and AIDS strategy. So those two global health initiatives of the church.
That's a long.
Yes, it is a long title. It doesn't even have a good acronym, but we'll go with it.
Well, I know you're in town now to talk a little bit about the Malaria Initiative, especially, and so maybe you could tell a little bit. I think probably many of us think we know a little bit about malaria, but don't know a lot. And I'm wondering if you could just tell us a little bit about the disease itself.
People who know a little bit about malaria might be people who were growing up or were around in the United States, especially the southern states in the late 50s and early 60s, which is about the last time that malaria was present in the United States. But now people who live on a more daily basis with the threat or reality of malaria are in developing areas of the world, are in more impoverished areas in the countries of the world. And so the experience of malaria, which is contracted through a mosquito bite, is symptoms within a day or two of that bite that are very flu-like by our description, of fever, achiness, fatigue, nausea, and then a gradual increase of those symptoms, especially in the very young, whose immune system or ability to articulate what they feel like would be lacking. Then those symptoms and that experience of malaria can be really life-threatening. So if you see the onset or observe and know the onset of symptoms, and within 24 hours, say, of that time period could be receiving medication, you would have a much better chance of surviving. Many people who are adults now in those areas have had experience of malaria, perhaps a little older in their life, and survived it. But the death rate is highest in those children, infants, under 5 years, and in pregnant women.